going to be talking about my endometriosis surgery recovery, how I've been doing, what I've been doing with my diet since then. So those of you who don't know me, my name's Michaela. I'm an award-winning nutritional therapist with PCOS, stage 4 endometriosis, and I also have experience personally with fibromyalgia, which I have thankfully recovered from. So those of you who've been following along will know that I had an emergency surgery late last year, and then about 4 months ago I had an excision surgery to remove stage 4 endometriosis. So I didn't know that I had endometriosis formally until I was having trouble with conceiving. My sort of fertility journey has been ongoing for a few years now. We had a miscarriage, and then since then I've not been able to get pregnant. So I had started looking into endometriosis because of my family history, and I was wondering if that was part of the picture. And while I was awaiting an appointment, I actually ended up in the hospital with an endometrioma. So since I've had the surgery, I have been doing well. My hormones are, I would say, very well managed at the moment. Those of you who have been following along will maybe be aware that I don't take any sort of hormone therapy, mostly being that I just personally don't get on very well with hormones. I was advised, potentially to take the pill after I had the surgery until I was ready to try and conceive again. But in the past, when I was younger and I've taken the pill, I've just really not gotten on well with any kind of the pill. I tried lots of different ones, and it just wasn't something that I felt I would be comfortable with. So I've not been taking any kind of contraceptive pill or hormone influence, and we've been cleared to conceive just only 2 months ago. So it's been a pretty ongoing up and down recovery journey. The surgery itself was great. We got absolutely everything out. Everything was excised apart from the tiniest little 2 mil from an ovary. I did check my egg reserve indicator, a blood marker, before I had the surgery, and then again afterwards, because one of the endometriomas was on an ovary and would have to be cut into. Fortunately, my egg reserve level was quite high for my age before the surgery, so it did drop, but it's still at a pretty decent level, which is encouraging. What I've been doing with my diet since I had the operation, initially I was really focused on just trying to restore my energy levels and support my body in that healing process. I was having to take, of course, lots of pain medication during that time. For me, a really big focus was trying to get the digestive system moving again. Anyone who's had surgery will know that you have to take lots of laxatives. And again, I'd had so much medicine through me. I really just wanted to try and do what I could to help things from a natural point of view alongside laxatives, and then eventually coming off of them. So I had lots of really high fiber foods, smoothies, soups, things that were really easy to digest during that time, which was really helpful. One area that I did really struggle in my recovery was to do with my bladder. So I think I just had a really bad time with having a catheter in. I wouldn't recommend it to anyone, but obviously sometimes you have to have a catheter. And the end result was that I had to have antibiotics on and off pretty consistently for about 7 or 8 weeks. So off the back of that, that's then impacted my gut health and my microbiome, and I'm looking into that, and I'll definitely be sharing that with everyone too. I think it's an area that maybe is not really thought about quite so much when you're going into surgery, and it's very often that you have to take antibiotics. So that's something that I will be sharing with all of you as I go along as well. So from a dietary side, I used to be, mostly gluten-free, mostly dairy-free here and there, but I have, since that initial surgery, become much stricter with myself with that, with being dairy and gluten-free. I'll probably do a talk about endometriosis and diet, and get a little bit more into the details of why that is, but it was really focusing on hormone influencers, inflammation, all these things that are really significant with endometriosis. Also been working on red meat. That's pretty much out of my diet. I would say occasionally we'll have something like a steak during my period, reason being that you're losing a lot of blood and iron during that time. When you have something like an infection, you shouldn't take iron as a supplement because it may potentially feed that infection. So I was not able to take a large amount of iron like I would maybe usually to try and build up my levels during that time. So that's been a big area of kind of things coming out, and also thinking about sugar as well, and alcohol, which I do miss, being Australian Italian mix, really missing wine, but mostly being okay not having it. And from a supplement side, again, everyone's very personal, but I've been really focusing on inflammation, hormone support, ovulation regulation, especially with the PCOS element that I have as well, stress management, working on the adrenal side of things and my thyroid as well, and just making sure that I've got a really strong support in place for myself. I went back to work after 3 weeks, which definitely was not enough time off. So I think that, for me personally with my recovery, putting in that space around being able to really unwind after work and relax and all that kind of stuff and build myself back up again was really important in the early stages, sort of in the first month or so when I was back at work, and just having those boundaries with myself. But I'm feeling back to my normal self with my energy levels now, which is great. Ovulating regularly, being cleared for pregnancy, or to try and get pregnant. Unfortunately, still not pregnant, which I think those of you who are also struggling with fertility know that it can feel like it's such an ongoing, never-ending thing. But I suppose for myself, I'm reminding myself that although it's been years that we've been trying, it's actually only been 2 years since we've had a clear sort of landscape. In a previous video I did, I talked about how much tissue had grown and there really wasn't much space, like physically, for anything to kind of get going in that area. So that's sort of how I'm managing that on a mental health side of things. I work with fertility a lot and I love working with it, but outside of working with me, if you are going through anything similar, or if you're wondering if maybe endometriosis or tissue growth or fibroids or PCOS might be part of why you're not able to get pregnant, definitely reach out, because that can be part of it. And they're all conditions that largely go underdiagnosed for quite a while and often not picked up until someone is trying to conceive. So that's kind of how I'm doing at the moment. I'm really enjoying being back at work. We've planned in some things over the year to look forward to, sort of just like little days here and there of stuff to do, places to see across the UK, now that we're closer to family, which is really nice. So that's where I am at the moment. So overall, hormones are doing well. Not pregnant yet. I will tell you when I am, but it might be quite far into a pregnancy, just with the history of miscarriage there. But I do try to be really open with all of you, because I think it's helpful, for me anyway, to know that other people are going through similar kind of situations. Working on inflammation, stress management, and trying to avoid having a catheter ever again for the rest of my life. So I hope you're all doing really well. Thanks for following along with my story. Like I said, I've got lots of kind of updates and information about all of this on my social media platforms. But yeah, do reach out if you feel like you have endometriosis, or if you do have endometriosis and you're struggling, and you sort of want to understand how you can try and manage things a little bit more naturally or alongside your medication that you're taking. One thing actually that I found to be so helpful, and I've just very recently posted about it, were castor oil packs. So before all the surgeries, I actually didn't really struggle that much with pelvic pain. But since having had the operations, that's been something that's kind of lingered for me. And in the past month, once I got past that 12 weeks recovery stage, I really wanted to do whatever I could to try and get further and further away from having to take pain medication. And in the past month, these castor oil packs have been so helpful for me with pelvic pain, to the point I haven't needed any pain medication. I've got some videos on how to make those, and I've also got a written guide if that's easier for you to follow along with as well. So again, if you try those, please let me know. Yeah, thanks again for following, and I'll see you soon.